4 hidden causes of persistent phlegm that are destroying your throat. Have you ever wondered why that annoying phlegm feeling in your throat just doesn't go away? Is there something more serious behind this seemingly simple symptom? Why do some medicines work for some, and for others they make no difference? Millions of people around the world suffer from this frustrating condition on a daily basis. That constant feeling of having something stuck in our throat that forces us to constantly clear our throats. The truth is that persistent phlegm can be much more than just a nuisance. In fact, it may be the warning signal your body is sending about more serious problems. Today, you will discover the 4 most common and dangerous causes of chronic phlegma. You'll also learn how to identify each one with absolute precision. And most importantly, you will learn practical and effective solutions for each specific situation. Get ready to finally understand what's going on with your body. Let's get started. 1. The secret behind phlegm that doctors don't tell. Phlegm is much more than just an annoying secretion from the throat. In fact, it is a sophisticated defense mechanism of our body. This viscous substance is produced by the mucous membranes that line our airways. Its primary function is to capture foreign particles, bacteria, and viruses before they cause damage. Under normal conditions, we produce approximately 1.5 liters of mucus per day. Most of this secretion is swallowed unconsciously without causing any discomfort. The problem arises when production increases dramatically, or when its consistency changes. This can happen due to irritation, inflammation, or infections in the airways. What few know is that the color and texture of phlegm reveal exactly what is happening. Clear phlegm usually indicates irritation or allergy without the presence of infection. Yellowish or greenish phlegm, on the other hand, signals a possible bacterial infection in development. The thick, sticky texture indicates dehydration or chronic inflammation of the mucous membranes. Understanding these differences is key to identifying the root cause of the problem. But there is one crucial factor that most people completely ignore. The persistence of phlegm for more than 2 weeks always indicates something more serious. Now that you understand the basics, you need to know the first devastating cause. 2. The shocking truth about reflujo and its throat. Gastroesophageal reflux is probably the most underestimated cause of persistent phlegm. Millions of people suffer from this problem without even suspecting the connection. Stomach acid, when it rises through the esophagus, does not stop only in the chest. It continues to rise until it reaches the throat, causing severe irritation to the mucous membranes. This constant irritation forces the body to produce more mucus as protection. The result is that lingering feeling of having something stuck to your throat. But what doctors rarely explain is that reflux can occur even without heartburn. Many people have silent reflux, where acid rises without causing burning. Symptoms include morning hoarseness, persistent dry cough, and a metallic taste in the mouth. It can also cause difficulty swallowing and a feeling of lump in the throat. The problem is especially aggravated at night when we are lying down. Gravity no longer helps keep acid in the stomach where it should be. For people over 50, the problem has a different cause. With aging, we produce less stomach acid, no longer as previously thought. This causes the lower esophageal sphincter to not close properly. Result: even small amounts of acid easily rise into the throat. If you suspect reflux, watch for these specific warning signs. Worsening of symptoms after large meals or acidic and fatty foods. Aggravation when lying down or bending forward right after eating. Presence of persistent morning bad breath, even with good oral hygiene. The solution starts with simple but revolutionary changes in food. Avoid coffee, chocolate, alcohol, and very spicy foods altogether. Eat smaller, more frequent meals instead of 3 large ones a day. Maintain a minimum interval of 3 hours between the last meal and sleep. Raise the head of the bed by 6 inches to take advantage of gravity. But there is a second, even more insidious cause that you need to know about. 3. Chronic sinusitis, the silent villain of your breathing. Chronic sinusitis is a devastating condition that affects millions of people silently. Your sinuses are air-filled cavities located around your nose and eyes. These cavities are lined with membranes that produce mucus to protect the airways. When these membranes become inflamed, mucus production increases dramatically. The problem arises when this mucus cannot drain properly through the natural channels. The result is a toxic buildup that travels down the throat, causing constant irritation. This post-nasal drip is responsible for that phlegm feeling that never comes out. Chronic sinusitis can have different causes that often go unnoticed. Poorly treated bacterial infections can lead to permanent inflammation of the sinuses. Nasal polyps, small benign tumors, can completely block drainage. Deviated nasal septum also prevents the normal flow of mucus through the ducts. Uncontrolled allergies keep the membranes in a state of constant inflammation. The symptoms of chronic sinusitis go far beyond simple nasal congestion. Pain and facial pressure that worsens when leaning forward are classic signs. Loss of smell and taste due to inflammation of the olfactory nerves. Persistent bad breath caused by the buildup of infected mucus in the sinuses. Chronic fatigue resulting from the immune system's constant fight against inflammation. Frequent headaches, especially in the frontal area and around the eyes. Nighttime cough caused by infected mucus dripping into the throat. Accurate diagnosis requires specific tests such as CT scans of the paranasal sinuses. But there are immediate steps you can take to relieve symptoms. Saline nasal washes help remove accumulated mucus. Use warm water with sea salt at a ratio of 1 teaspoon per cup. Inhalations with hot water vapor open blocked drainage channels. Add a few drops of eucalyptus essential oil to enhance the effect. Always stay well hydrated to dilute mucus and facilitate its elimination. But the third cause can be even more insidious and difficult to detect. 4. Allergies. The invisible enemy that's suffocating you. Respiratory allergies are responsible for cases of phlegm that last for months or years. Your immune system, designed to protect you, sometimes overreacts. Harmless substances such as pollen, dust mites, or animal hair become enemies. When you come into contact with these allergens, your body releases histamine. This substance causes inflammation of the mucous membranes and increased mucus production. The result is an inflammatory cascade that can last for weeks after exposure. The mucus produced by allergies has specific characteristics that identify it. It is usually transparent, sticky, and is associated with other allergic symptoms. Itchy eyes, frequent sneezing, and nasal congestion are typical signs. Seasonality is one of the most important indicators of allergic origin. If your symptoms worsen in the spring, it's probably pollen allergy. Symptoms that worsen indoors indicate dust mite allergy. Worsening in the presence of animals suggests allergy to animal hair or saliva. Food allergies can also cause excessive mucus production in the throat. Milk and dairy products are the main villains in this specific aspect. Many people are lactose intolerant without knowing it and suffer for years with phlegm. Wheat, eggs, and seafood can also cause mucosal reactions in sensitive people. Accurate allergen identification is critical for effective treatment. Skin or blood allergy tests can reveal exactly what's causing the problem. Meanwhile, some measures can drastically reduce exposure to allergens. Keep windows closed during periods of high pollen concentration. Use air purifiers with HEPA filters to capture microscopic particles. Wash bedding weekly with hot water above 60 degrees. Vacuum carpets and upholstery regularly with a vacuum cleaner equipped with a HEPA filter. Avoid stuffed animals and heavy curtains that accumulate dust mites. Keep the humidity of the environment between 40 and 50%. But there is a fourth cause that may be the most dangerous of all. 5. Infections, when your body screams for help. Respiratory tract infections are the most obvious cause, but also the most dangerous. Viruses, bacteria, and even fungi can infect from the throat to the lungs. When this happens, your immune system goes into a state of high alert. The resulting inflammation dramatically increases the production of mucus as a defense mechanism. This mucus contains defense cells, antibodies, and antimicrobial substances. Its function is to capture the invaders and expel them from the body through coughing. Viral infections usually produce clear or slightly whitish mucus. Bacterial infections, on the other hand, tend to produce yellowish or greenish discharge. The presence of blood in the mucus always indicates a serious infection that requires medical attention. Fever above 38.5 degrees is a sign of systemic infection. Chest pain or difficulty breathing indicates lung involvement. Extreme fatigue and loss of appetite suggest that the infection is spreading. The duration of symptoms is crucial in determining the severity of the infection. Simple viral infections rarely last more than a week. Symptoms that persist for more than 10 days usually indicate bacterial complication. A productive cough that gets worse rather than better is a red flag. Appropriate treatment depends on the specific type of causative microorganism. Viral infections usually resolve on their own with rest and hydration. Bacterial infections, on the other hand, may require specific antibiotic treatment. Never ignore signs of pneumonia, such as chest pain and shortness of breath. Self-medication with antibiotics can mask severe symptoms and cause resistance. Seek immediate medical attention if you have a high fever and difficulty breathing. But now you need to know when to seek professional help urgently. 6. The warning signs that can save your life. There are specific symptoms that should never be ignored when it comes to phlegm. These signs may indicate serious conditions that require immediate medical treatment. Blood in phlegm, even in small amounts, always deserves urgent investigation. It can indicate from serious infection to more serious lung problems. Persistent fever above 39 degrees that does not respond to medications. Difficulty breathing or feeling short of breath at rest. Severe chest pain that worsens with deep breathing or coughing. Unexplained weight loss associated with chronic phlegm production. Hoarseness that persists for more than 2 weeks with no apparent cause. Changes in the voice may indicate problems with the vocal cords or larynx. Swelling of the lymph nodes in the neck that does not subside after 2 weeks. Intense night sweats that completely wet the pajamas. Extreme fatigue that interferes with basic day-to-day activities. Total loss of appetite accompanied by persistent nausea. Any of these symptoms combined with persistent phlegm requires medical evaluation. People over the age of 60 should be especially vigilant. The weakened immune system makes infections more dangerous in this age group. Smokers or former smokers also need more careful medical attention. A history of smoking significantly increases the risk of pulmonary complications. People with chronic diseases like diabetes or heart disease are more vulnerable. These conditions can mask or aggravate respiratory tract infections. Don't wait for symptoms to go away on their own if you have risk factors. Prevention and early treatment are always the best strategy. Now let's go to the natural remedies that can revolutionize your treatment. 7. 5 miracle remedies that eliminate phlegm in days. Nature offers powerful solutions to combat persistent phlegma effectively. These remedies have been tested for generations and validated by modern science. The first and most important is proper hydration with plain water. Drinking at least 2 liters of water a day dilutes mucus, making it easier to eliminate. Dehydration makes the phlegma thick and sticky, making it difficult to expel it naturally. Warm water is even more effective as it relaxes irritated mucous membranes. Add a pinch of sea salt to create a natural isotonic solution. The second miracle remedy is thyme tea with exceptional mucolytic properties. The thymol and carvacrol present in thyme dissolve the thick mucus. Prepare by boiling a tablespoon of dried thyme in 250 milliliters of water. Let it infuse for 10 minutes, strain and drink 3 times a day. The infusion steam can also be inhaled to enhance the effects. The third remedy is fresh ginger with its powerful anti-inflammatory gingerol. Cut a 2-inch slice of fresh ginger and boil for 15 minutes. Add pure honey and lemon to boost the antimicrobial properties. Drink this preparation 3 times a day for amazing results. Ginger reduces inflammation of the mucous membranes and facilitates the expulsion of mucus. The fourth remedy is raw garlic with its powerful antibacterial allicin. Chop 2 cloves of garlic and let it rest for 10 minutes. This allows for maximum formation of allicin, the most potent active compound. Swallow the pieces with water or mix with honey for easy ingestion. Garlic strengthens the immune system and fights infections directly. The fifth remedy is the humidification of the environment to keep the mucous membranes hydrated. Dry air irritates membranes and increases the production of defensive mucus. Use humidifiers to keep the humidity between 40 and 60%. Alternatively, place bowls of hot water in the rooms you frequent. Add a few drops of eucalyptus essential oil to enhance the effect. Steam inhalations are also extremely effective at loosening mucus. Boil water in a saucepan and inhale the steam with a towel over your head. Add eucalyptus leaves or a few drops of the essential oil. Do this for 10 minutes, 3 times a day for best results. But there are essential daily care that you need to know for prevention. 8. The secrets of prevention that no one taught you. Preventing persistent phlegm starts with simple but revolutionary habits. These secrets can save you years of unnecessary suffering. Avoid excessively cold air-conditioned environments altogether. Cold, dry air dries out mucous membranes, making them more susceptible to irritation. Whenever possible, prefer natural ventilation to artificial air conditioning systems. Your throat will thank you for this seemingly small change. Immediately stop consuming foods that increase mucus production. Dairy products, especially whole milk, are the main villains in this regard. Refined sugar also stimulates the excessive production of mucus secretions. Processed foods contain additives that irritate respiratory membranes. Always prefer natural, fresh, and minimally processed foods. Citrus fruits, except during active infections, help thin mucus. Green leafy vegetables provide antioxidants that reduce inflammation. Maintain a moderate exercise routine to strengthen the respiratory system. Physical activity improves circulation and helps with the natural drainage of mucus. Daily walks of 30 minutes are enough to make a significant difference. Avoid very intense exercise during episodes of abundant phlegm. Overexertion can worsen irritation of the airways. Always sleep with the head slightly elevated for easy drainage. Use 2 pillows or raise the mattress by 6 inches. This prevents the buildup of mucus in the throat during sleeping hours. Practice deep breathing techniques to strengthen your breathing muscles. Inhale slowly through your nose for 4 seconds, hold for 4, and exhale for 8. Repeat this exercise 10 times, 3 times a day. This simple practice significantly improves the ability to expel mucus. Keep your home clean and free of common allergens at all times. Regularly vacuum carpets, curtains, and upholstery where dust mites accumulate. Use natural cleansers to avoid chemical irritation of the airways. Change air conditioning filters monthly to maintain air quality. Now you have all the knowledge you need to transform your respiratory health. Millions of people suffer needlessly from persistent phlegm every day. They do not know the real causes and continue to treat only superficial symptoms. You now have the power to identify the root cause of your specific problem. Most importantly, it has practical and effective tools to solve it definitively. Don't let the persistent phlegm continue to rob you of your quality of life. Implement these strategies starting today and feel the difference in a few days. Your body has an incredible ability to heal itself when you provide the proper conditions. Always remember, your health is in your hands, and small changes generate big results. Start your journey towards free breathing and a healthy throat now. Life without persistent phlegm is within your reach. Just take the first step today.